A new report is shedding light on the staggering risks for preterm birth and maternal mortality in the U.S. The new March of Dimes report card shows the U.S. has a D+ grade for preterm birth, showing 10.4% of babies were born before 37 weeks gestation. The report also shows the maternal mortality rate doubled between 2018 and 2021. ABC News medical contributor and emergency physician Dr. Darian Sutton joins me now for more on this. Dr. Sutton, what does this grade mean? When you looked at this report, what stuck out to you when you saw D+?
At first, I've never seen that score on my report card. So when I looked at this report, it was abysmal. And I think when we look at the rates of maternal health and the disparities that exist, it is a symbol of the cracks in our healthcare system. And when that happens, usually the most marginalized fall through first. That includes those who are pregnant, those who are disabled, and so on and so forth. The goal is to keep this score at 8% or lower. But obviously, given that score, the United States has a rate of 10.4%, which to many might not seem like a lot, but the risk of preterm birth includes learning and vision difficulties, cerebral palsy, increased risk of asthma, and it's the #1 cause of infant death. So it's an important number to pay attention to and an important number to work to decrease.
That preterm birth rate for babies born to Black people was also 1.5 times higher than all other babies. What do you make of that?
It's a number that we keep seeing time and time again. Black mothers in this country are disproportionately at higher risk of death during their pregnancy and after delivery. Black mothers are 2 to 3 times more likely to die during their pregnancy or after delivery. Their infants almost 2 times more likely to die after delivery. And the reasons behind this are multifaceted. In one point, there's access. Black mothers usually are Medicaid or insured. About 60% of Black mothers delivering are insured by Medicaid. That in and of itself decreases access when you compare to those who are insured by private access. And then also access to care, transportation. And also there's a discussion about the weathering hypothesis, which is chronic social and economic disadvantage leads to poor health outcomes. And then when you compare Black mothers who have access and high socioeconomic status to those who don't have much access, the disproportionate is still there. And so that tells us that there likely is some ingrained racial and systemic racial discrimination that exists among Black mothers, which is the reason why we see these concerning numbers.
And this isn't just preterm birth, it's also maternal mortality. Women going to give birth to their children and they end up dying in the process. They're saying that number doubled over the past few years. What do you think about that? We're a first world country. What do you make of these stats and what needs to be done to reverse this?
Of the highest income countries, we have the highest rates of maternal mortality. When you compare any high income country, as reported by JAMA in 2023, next up is France. We were 3 times higher than that. What I take about this is that when we look at the maternity health care access, we have maternity health care deserts within this country. Approximately 30% of the counties within the United States have no access to an OB, obstetrician, to help mothers deliver care. That constitutes 2.2 million women. So when we look at the policies and the effects that we need to change, access is really important.
All right. ABC News medical contributor and emergency physician, Dr. Darian Sutton, thank you.
Thank you.
Hi, everyone. George Stephanopoulos here. Thanks for checking out the ABC News YouTube channel. If you'd like to get more videos, show highlights, and watch live event coverage, click on the right over here to subscribe to our channel. And don't forget to download the ABC News app for breaking news alerts. Thanks for watching.